Well, good afternoon, everybody, and thank you for joining today's update on COVID-19. As of today, we have had 802,065 lab-confirmed cases, 2,786 new cases reported since yesterday, 2,374 people in the hospital, and sadly, 10,046 people who've died. We've passed the grim milestone of 10,000 deaths in North Carolina. And it's a stark reminder of how dangerous this virus can be. Our prayers are with those who've lost loved ones to this cruel disease. Our numbers, though, remain stable, which is good, and we're encouraged to see a continued decline in our hospitalizations and percentage of positive COVID-19 tests. Still, we must keep our guard up. This virus and its variants are still spreading too easily. Doing the simple things that we know work, like wearing a mask and social distancing, will slow the spread and save lives until vaccines are more widely available. Distributing vaccine quickly and equitably remains our top priority in North Carolina. We continue running an efficient vaccine distribution and are getting all of North Carolina's allocated first doses into arms each week before we receive the next shipment. And I'm grateful for the work of our Department of Health and Human Services and the vaccine providers across this state who are delivering this life-saving vaccine as quickly as possible. Speed is critical, but we're also emphasizing equity. Communities of color have been disproportionately impacted by this devastating pandemic, and the state is working to reduce the high rates of sickness that this population is experiencing. The health care coverage gap in North Carolina has left many without access to a doctor. Add to that long-standing systemic inequities in our health care system, and you can get mistrust of this vaccine as well as lack of preventive care. We're working to address those inequities. We can start by making sure that every community has access to these vaccines. And that means making a conscious effort to track the data and seek fairness in vaccine distribution. When North Carolina received its first allocations of doses, we sent them to every single county in the state. And our team has ramped up efforts to include vaccine providers that serve communities of color. They're reaching out to underserved communities and paying attention to equity and how they allocate doses, including weekly vaccine events. And it's important to let the public know exactly what we're doing. North Carolina has been recognized nationally for our work sharing data about race and ethnicity with vaccinations and confirmed COVID-19 cases down to the county level. And the department will continue to make this information widely available. Dr. Mandy Cohen, our Secretary of Health and Human Services, has led this effort, and she'll talk more about those in a few minutes, those steps that we're taking in a few minutes. North Carolina is making some progress in improving vaccine access for Black North Carolinians, although we have more to do. Last week, 18% of vaccines were administered to African Americans, up from 11% 4 weeks earlier. That's a 65% increase. This is an improvement, but there is more work to be done when North Carolina's population is 22% Black. Also, in our Latinx community, vaccination rates have been especially low. Today, I'm issuing Executive Order 193, which will extend previous orders giving the Department of Health and Human Services Secretary the ability to temporarily waive industry regulations in order to speed vaccine distribution. Today's order gives the department the authority to expand the types of providers to administer the vaccines. As the state continues to fight the pandemic and protect North Carolinians, I am ordering today state officials to marshal all of the state resources, including property, facilities, and personnel, upon request by the North Carolina Department of Health and Human Services, to help with vaccination efforts as our supply continues to increase coming in. We know that there's still not enough vaccine supply to vaccinate the millions of people who need it, not by a long shot. We're pushing for more, And today, on a call with the Biden administration's coronavirus team, we were told North Carolina would get another 5% increase in vaccine supply this week. That's good. Now, I know all of this is hard, and I want people to know that I am committed to making sure that vaccine gets to every North Carolinian as quickly and as fairly as possible. And in the meantime, please, we have to keep wearing our mask and doing the things we know work to slow the spread of the virus. If we keep doing what works, I know we'll get through this. At this time, I'll invite Dr. Mandy Cohen to share an update on our vaccine rollout, and particularly as it relates to equity. Dr. Cohen.
Thank you, Governor.